Okay, it is 6 o'clock, so we will go ahead and get started. I'd like to welcome everyone to the Dayton VA Medical Center's webinar on celebrating 100 years of providing and expanding healthcare for women veterans. And we are thrilled to be with you here this evening. I want to start by saying this event is being recorded, so if there's something you miss and later want to rewatch, you'll be able to do so. We will be sending you a link to that recording after the event. You can also share that link with anyone you feel may benefit from the information we provide tonight. I'm Brandon Zita with the Community Outreach Office here at the Medical Center. Please realize that as a participant in this session, your microphone has been muted to minimize distracting background noises. We have quite a few participants on this webinar, which is why we're keeping everyone muted. Again, this is simply to ensure that there is not an excess in distractive background noises. And this does not mean that we don't want to hear from you. So if you have a question or concern, you can share it with the panelists through the chat pane. You should be able to find this in the bottom right of your screen. Simply type in your question and one of the presenters will get to you as soon as they can. And for the sake of time, if we don't get to your question during this presentation, you can reach us by phone or email, and we will provide that information to you at the end of the webinar. As I said before, we have some exciting news we're sharing this evening. The VA is celebrating 100 years of providing and expanding health care for women veterans. Some of the topics we'll discuss will be the Service Act, maternity care, and spirituality groups, among others. And we have with us live this evening some experts to help answer any questions that you may have. First, Dr. Nicole Armitage, an Air Force veteran who serves as the Women Veterans Program Manager at the Dayton VA Medical Center. Amy Purnell Davis, also an Air Force veteran who serves as the Nurse Manager in Primary Care at the Dayton VA Medical Center. And Chaplain Cynthia Mason is the Women's Health Chaplain for the Dayton VA Medical Center. Again, I am your host, Brandon Zito, with the Medical Center's Community Outreach Office, and I will help answer any questions you might have about the Dayton VA in general. Before we begin with questions, our team will give a brief presentation that goes into more detail about healthcare services offered to women veterans here. And so I'll pass that on to Amy. Take it away, Amy.
Good evening, everyone. It's an honor to be with you this evening. We're going to get started with a little bit of history about women serving in the military. So next slide. So in 1901, women were officially recognized as being military members, but it wasn't for 22 more years that women were accepted for medical care at the VA. In 1948, women became a permanent part of the United States military. However, they were capped to specific jobs, and that cap was at 2%. In 1967, that 2% cap was lifted, and senior officers' ranks opened to female members of the military. In 1973, it was the advent of an all-voluntary force. And in 1990, the census found that 1.2 million women were veterans. In 1983, the VA Advisory Committee report indicated that female veterans had inadequate privacy and care at the VA. So in 1994, Women Veterans Program Office was established. In 2015, the ban on women in combat lifted. As of 2021, over 2 million women there are over 2 million women veterans. That's 12%. I really like this slide because this arrow indicates it starts in the year of 2000 and goes to current year 2023. In 2000, there were approximately 159,000 female veterans. We have 5.5 times that to the current number of 990,000 female veterans in 2023. So let me take a minute to tell you a little about the women veterans that are seen here at the Dayton VA. We currently have over 6,000 women receiving care at all of our sites. Our sites consist of the Dayton main campus here in Dayton, Ohio. We have community-based outpatient clinics in Richmond, Indiana, Lima, Ohio, Springfield, Ohio, Middletown, Ohio, and out at Wright-Patterson Air Force Base. We have 4,100 women actively enrolled in prime care. 2,700 of those women are at Dayton. 1,400 receive care at the C box and at Wright-Patterson Air Force Base in the VA clinic. 200 plus more women each year are seeking care here at the Dayton VA. Here at Dayton, women make up 13.3% of active enrollment population. Services that we offer the female veteran here in-house at the Dayton VA is well woman and preventative exams, including cervical cancer and osteoporosis screenings. We provide contraceptive services and management. We also provide guidance and care with menopause care, GYN specialty care, comprehensive mental health, and whole health. Healthcare benefits provided through partners in the community include breast cancer screening mammograms, maternity care services, and infertility evaluations and treatment. I'm now going to turn it over to Dr. Nicole Armitage so she can go over our new exciting expansions in care.
Thank you so much, Amy. So I'm happy to be here this evening to tell you some exciting things about some new things that we're offering here at the VA. So one thing is the expansion of our maternity care. So the VA has offered maternity care as a benefit for quite some time. And so that it's a really great benefit. It's not done in-house. However, we partner with our community partners to be able to provide maternity care. And that includes care throughout pregnancy and also includes care for the baby for the first 7 days of the baby's life. And during that time, we have a women's health care coordinator or a maternity care coordinator who contacts the veteran throughout their pregnancy. And in the past, the care coordinator contacted veterans up until 12 weeks postpartum. But what's changed is that care coordination now goes throughout pregnancy and to 1 year postpartum. And this is a really wonderful benefit because what the care coordinators do as soon as a referral is placed for maternity care, they get a notification and they reach out multiple times during a pregnancy and multiple times during that postpartum year to ensure that women are getting the care that they need. They also set up things like ordering breast pumps and nursing bras and things like that. And they facilitate any appointments that are needed outside the regular OB care, such as, if mental health care is needed, or if we actually have physical therapists who provide pelvic floor rehabilitation during pregnancy and postpartum, so they can help set that care up, or, seeing a pharmacist to talk about medications, that kind of thing. So it really is a wonderful benefit, and the VA recognizes that women's needs don't end at 12 weeks postpartum. And so now we're able to stay connected with veterans, and we do stay connected throughout the whole first year. Next slide. Another new thing is the Service Act. And so this has to do with breast cancer screening. So currently, the VA and the VA has for a long time followed the American Cancer Society guidelines for breast cancer screening. And what those guidelines state is that screening mammograms should be considered starting between age 40 to 45 for most women, and then should occur yearly between the ages of 45 and 54, and then every 1 to 2 years after the age of 55, assuming that the mammograms have been okay. And again, we do have our women's health navigators who coordinate this mammogram care. However, recently we've enacted the Service Act, which stands for Supporting Expanded Review for Veterans in Combat Environment. And what this does is it provides for earlier breast cancer screening than we would normally have started at the age of 40 for veterans who have had exposures to things like burn pits while they were deployed during certain times. And so it's, if you've heard of the PACT Act, it's kind of like the PACT Act, only this is specific for breast cancer screening. And it primarily affects women who are ages 30 to 39. So if you are a woman who is in those ages and you may have had some toxic exposures, then you should talk to your provider about possibly getting early screening. And I'm going to hand it over to Chaplain Mason.
Good evening. I am Chaplain Mason, the chaplain for the women veterans. I just want to briefly talk about the new spirituality group that starts October the 16th. It will be in building 305, the auditorium, front part of the auditorium, from 11 a.m. to 12 p.m. And it's called Women in Crisis, Finding My Way Back. It's an opportunity for the women to come together and talk about whatever they're going through. It's not going to be any set topic, but just we want to feel what you have going on and just come together, collaborate together as women veterans, and help each other in a way that may help you. You may be going through the same thing. So I wanted to bring this an opportunity for them just to talk about whatever crisis they're dealing with.
So
Okay.
on this slide, I'm sorry, there are some resources here for you. The top website is for the VA Center for Women Veterans. And there's a link there which is difficult to just click on when you're looking at the webinar, but you can see the web address there. And on that site is just a wealth of resources that the VA has for women veterans. And then the second site is also a VA site for women veterans healthcare. And again, it has a wonderful amount of resources for women veterans. The third thing is for the Women Veterans Call Center. That's a number, it's separate from like the crisis center. It's not just to call for crises, but for any questions or, anything, that you might have about getting care in the VA or how you get it or whatever questions you have. And then my contact as the Women Veterans Program Manager is there in case anybody needs to reach me with any questions or help navigating their way through the Dayton VA system. Thank you.
Okay, well, thank you, team, for that informative presentation. Appreciate it. So let's take some time to answer questions we've received through the chat pane. A reminder, in the bottom right of your screen is the chat bubble. If you have any questions, please go ahead and ask away. We'll get to them with the time we have remaining. If we don't get to your question, we still want to answer it. So we'll give you a way to contact us at the end of the presentation. So I've got a couple of questions here, and I will just start reading them as they came in, and I'll let the team decide how to answer them. First question is, how can I enroll with a provider in the women's clinic?
Did you want to take that, Amy, or would you
Yes,
like me to
ma'am. I
take
was
that?
finding the right button to push. So there are actually several options that you have. You can come into the women's clinic directly. They'll assist you with providing you with a form to fill out for eligibility and to get you enrolled. Additionally, you can come into the main building, building 330, and go to the eligibility desk and complete the form. And then, forgive me, I don't remember the number. It's very similar to a tax form. I think it's like a 10 easy form, but that's not important. They know the form number. They know the right form to give you. Just tell them that you would like to enroll. We do encourage you to bring your DD 214 with you, so that can be verified that you're eligible for care. And there's always resources also on those web pages that Nicole had on the last slide there. You can always visit any VA web page and type in, how do I enroll? And it's easy to find. But here at Dayton, we try to make it as easy as possible. Like I said, you can come in the women's clinic and do it, or go to the eligibility desk in building 330.
And you have a very good memory, Amy. It is the 10-10 easy, so thank you.
Thank you.
Question number 2, can I request a female provider for my primary care provider?
I'll take that one as well. Yes, you may request a female provider as your primary care provider. I do want to make a point that on the outside of our women's veterans clinic, it's what it says, it's Women Veterans Clinic. A lot of people think that that's a clinic only for gynecological issues. Our clinic does provide comprehensive care. It is internal medicine and family practice providers, and they do provide, like I said, comprehensive care to you, to include the gynecological things that we mentioned previously in the slide. But you do have the option of requesting a female provider.
Another question, how can I get a referral to see the Women Veterans Chaplain?
Nicole, or Chaplain, I'll let you take that one.
Well, usually I receive referrals from the women's clinic. However, you can get a hold of me directly by just calling the 937-268-6511. My extension is 2879. So you could call me directly.
Perfect, thank you. So another question is, how do I get a referral for maternity care?
Would you like me to take that one?
Sure.
What you would do is go to your primary care provider if you think that you're pregnant, and they would, talk to you about, any concerns that you're having, order an official pregnancy test probably, and then they would put in the referral for maternity care. And that would go to community care, and then the community care office will contact you to facilitate getting that care set up in the community.
So a follow-on question to that, does the maternity care cover the baby?
It does cover the baby up to the first 7 days of life, which in most cases will cover the initial hospital stay that the baby has and everything. But after that, the baby is no longer covered since the baby's not a veteran. So it would be important to think about, what kind of health coverage the baby would have after the 7 days.
The next question is the VA doing mammograms?
I can take that question. Currently, we partner with our community healthcare breast centers for mammograms. So what you do is you come in or call in if you're due for your mammogram, and your primary care provider will put in the consult, and community care will give you a call, and they'll ask you, do you have a preference where you would like to have your mammogram? Have you had it, say, at Kettering or Premier, or do you want to go back to that same facility? That is allowed. But currently here at Dayton, we are not doing mammograms actually at the facility, but we are partnering with all of our community partners that have breast centers, and it is covered by the VA.
Thank you. A similar question, how do I get a mammogram under the Service Act?
I can take that one. The thing to do first is to have an appointment with your primary care provider. What they will do is ask questions about toxic exposure and or see what the toxic exposure screen, if you already had that done, what that shows. And then they will talk to you about your personal risk of breast cancer, taking into consideration your family history, your personal history, and your toxic exposure, and then talk with you about if it makes sense to have earlier screening mammograms. And then if it does, they will put that order in. And then that again will go to community care, and that will be covered.
Great, thank you. Another question, does the VA provide infertility treatment?
I can take that one too. Infertility treatment is a covered benefit as well. There are a lot of, but some of the advanced infertility treatments have a very strict eligibility criteria. So if a veteran thinks she might have problems with infertility, again, would make that known to her primary care provider, who could then put in a referral to the community, because this is another thing, we partner with the community for an infertility evaluation and treatment. However, some of the advanced, and that's really all that requires is being an enrolled veteran. But for things like in vitro fertilization or some of those advanced techniques, that's covered by a different law, that's actually covered by a law in Congress, and it has very strict eligibility criteria. And the criteria basically are that you have to be married, and it has to be one partner has to have a uterus, another partner has to have sperm, and they have to have their own eggs and sperm. And then the person with the infertility, the veteran with the infertility, has to have their reason for infertility be a service-connected condition. So in those cases, the VA would also cover IVF or some of those advanced infertility treatments.
Gotcha, thank you. What services are available to people who have MST?
I can take that one. We do have our MST coordinator here at the Dayton VA, so you can seek care and treatment from them, just if that just means from talking to any kind of treatment plan. Also, we have mental health primary care dedicated to the Women's Health Clinic. And then we do have our own mental health service. So, and then chaplain services as well. So we have lots of ways to help with that and encourage you to seek treatment and help for it.
I have, it looks like, one last question in the queue. We'll see if any more pop up. What care do you have for breast cancer?
I can take that as well. So for if somebody is diagnosed with breast cancer, typically with an initial diagnosis, we will send people to the community for definitive treatment. That usually means going to see a surgeon or somebody that can do a surgical procedure. And then depending on what other treatment they need, that may also be done, maybe with radiation oncology or an oncologist in the community. However, we do have oncologists at the VA that do follow patients, you know, after they get their initial treatment. And in fact, we also have like a lymphedema clinic. So we have specialists that can help with lymphedema, that swelling that can occur because of lymph nodes being removed for breast cancer. And uh, um, we have like a holistic program approach for oncology that a lot of patients get enrolled to. And so there's actually quite a lot of services in-house to follow patients after their initial treatment and make sure that they're okay.
Perfect, thank you. I do not see any more questions. We'll give a few seconds in case someone else wants to chime in and add one. But if not, I think we can wrap this up and say that's all the time we have for this evening's session. And we hope you found this both helpful and informative. And if we did not get to a question that you may have had but didn't want to ask, didn't want to share with the group, feel free to contact our women's clinic at 937-268-6511, extension 3921. For information about applying for VA healthcare, you may call our eligibility and enrollment office at 937-267-7608 for questions about how to enroll with the Dayton VA. And if you have any questions for myself with the community outreach team, please call 937-658-5189. For those who are not currently enrolled with the Dayton VA for healthcare, there are several options for being able to enroll. You can do it in person, online, through the call center, or by postal mail. And as was mentioned earlier, before, we have a community-based outpatient clinics we refer to as CBOCs, and they are in Lima, Middletown, Richmond, Indiana, and Springfield. And I would like to say thank you to our panelists for all the great information they've shared with us this evening. And thanks again to everyone who attended the event. I'd like to say thank you and have a great rest of your evening. And thanks to all our veterans for their service to a grateful nation.